Hi, Janice. Thank you for doing this interview this morning. For people watching this for the first time, we are doing an ongoing series called Big Life that focuses on how people from various backgrounds live their lives to the optimum. So, Janice, did you have any idea as a little girl that you would one day become a doctor?
Well, I know that I used to watch my mom get adjusted. She had a hip problem, and she would go in and see chiropractors, and she would come in pain. She would lay on the table. He would do his thing on her, and she would get up feeling no pain. And I thought, whatever he's doing, that's really neat.
Oh.
So I don't know at that moment I wanted to be a chiropractor, but then when I was in college, my mom went to see her chiropractor for an upper back issue, and she came home and it was still hurting. And she said, "This is what I need you to do. Can you just do this?" And I did it, and it moved, and she felt better. And so I thought at that moment, this is something that could be really cool.
Okay,
Yeah.
that's super cool. Super cool. So you grew up here in the San Diego area, correct?
I did.
Okay, and what types of activities were you into growing up?
Not much. I wasn't into sports at all. We did ride our bikes at time. I grew up in the country.
Oh,
in
okay.
North County, in Valley Center.
Oh,
so
nice.
we rode our bikes a lot, and we were active outside. But I was mostly kind of a nerdy indoors reader type of girl. Yeah.
All right. Awesome, though. That's really cool, that story about your mom. That's super cool. Is there an area within chiropractic that you specialize in?
I really enjoy working on people that have never seen a chiropractor.
Okay.
Because I believe they need to feel safe and comfortable, especially. A lot of people are really nervous about having their neck adjusted.
Yeah.
Which is understandable.
Right.
So I like to really make them feel safe and go through kind of a slow process before I actually put my hands on them. So those people are my very favorite. And then I love working on kids. And I believe that chiropractic can be gentle and still be effective.
Okay, that's
especially for women. I think we're a little more fragile, and a lot of women don't want someone using so much force on them.
Yeah.
So I believe things can be done gently, and they can still get relief.
okay, because I'm a big advocate for chiropractic. I grew up in Davenport, Iowa, and everybody got adjustments, and so I'm always trying to encourage clients and friends to, get maintenance. So
Definitely.
That's cool. So if someone came to your clinic for the first time, what could they expect?
Well, I do a full exam on them, a neurological exam. I get their medical history. I have to make sure it's safe to adjust them.
Okay, that makes sense.
And then I give them a treatment, and then hopefully they're feeling better by the time they leave.
Okay,
Yeah.
all right. So what do you personally do to keep yourself in good shape in order to maintain a successful practice?
Well, first and foremost, I get adjusted at least once a week.
Okay.
We're kind of bent over patients all day.
Yeah.
So it's really important to keep my body moving well, so I get adjusted regularly.
Okay.
The newest thing I'm doing is juicing, which I'm really, really excited about. I bought a very fancy blender, and you can just throw the whole apple in there, and it just it's so smooth, and you can throw anything in there, kale and greens and spinach,
Nice.
and then I put a little fruit in there to make it yummy.
Yeah.
And then, so I think juicing is really, really good. The other thing is water.
Okay.
Most people are just totally chronically dehydrated.
Yes.
And the research is showing now that people that are chronically dehydrated, that's contributing to diabetes, cancer, and heart disease.
Okay. I couldn't agree with you more, and I recently got into juicing myself. That's
Isn't it
cool.
fun?
Yeah, it's
and then
very
so the
fun.
new recommendation for water they're saying is take your body weight, divide it by 2, and that's how many ounces you should be drinking. So it's a lot, but every cell needs water. So
That's exactly what I tell clients, because that's a simple way to do it. I was just giving that analogy yesterday, as a matter of fact.
Oh, perfect.
Yeah. So excellent, Janice. Hey, I just wanted to thank you very much for doing this with us this morning. And if someone wanted to contact you for a free consultation, how would they do that?
Well, thank you for having me. I have a website. It's www.brennegerchiropractic.com, and our office phone is 619-258-1011, or you can email me at drjaniceprout@yahoo.com.
Great. Thanks again, Janice.
Thank you.